Well, hello, it's Bruce Williams again, and today I'm pleased to present the second lecture in my series on the gross pathology of the urinary tract, where we're going to talk about some developmental abnormalities which are seen in this system. As I do at the beginning of all of my lectures, I want to thank this growing list of individuals who have been so kind to me over the years in allowing me to share their wonderful images. Let's start with a congenital defect that's one of the most common in people and is also documented in a range of domestic species. This is a great picture by Dr. Aaron Edwards of a puppy, and you can see that there is a problem with the external genital tract here, and there is a groove that runs all the way from the tip of the preputial orifice all the way back to the perineum, where the urethra is located. What we're looking at in this groove is actually we're looking into the urethra. The condition is known as hypospadias, and it is a multifactorial condition which certainly can be genetic. As you can see, these cluster in family units in a number of species, but probably also has some environmental and endocrinological factors associated with it. Another change you can see here is that there is no scrotum proper. The testes are both descended, but they are within the skin near the perineum, also known, and they're separated, also known as a bifid scrotum. I don't know what you call it because there's no scrotum, but this is often seen in animals. It is a defect that's only seen in males. And it's also been documented, maybe most commonly, in goats, which have a lot of congenital reproductive and urogenital abnormalities. This is a very similar situation here in this young male goat. You can see testes on either side, but we get a good look at the urethra in the perineal area. These cases are often classified based on where the urethra is found. So you can call it perineal, anal, or penile, depending on how extensive the defect is. We mentioned that there may be environmental factors here, and certainly it's been shown in laboratory mice, but it's also been documented in production animals that when the dam is fed a source high in phytoestrogens, such as red clover or pistachio orchard trimmings or soybeans, that the incidence of this goes up, and mice that have been, there's been reproduced commonly in mice that are fed estrogen compounds or androgen blockers. So hypospadias. Okay, here's a case of hydronephrosis in a young pig, and we talked about hydronephrosis in the last lecture and how it is primarily the result, or exclusively the result, of obstruction. And this is not that uncommon in the in young pigs or piglets, and it's thought to be due to kinking of the ureter. And a lot of cases of dysplasia in humans have been associated with ureteral kinking. And poor development of an organ is not uncommon. I think the best examples are the widespread various defects associated with atresia of part of the GI tract that we see, especially in ruminants. And the concept that I want to get across is, as an animal developed, organs just, in order to pack everything into the developing fetus, often go a lot of twists and turns. Think about how many times the reproductive tract has to double back on itself and flip and turn and twist just to get all of your guts put into your abdomen for when you're born, especially in cattle. So that's why we see such a high incidence. When these organs during their development get kinked and the blood supply to them is disrupted, you get significant developmental developmental abnormalities. And in pigs, it is thought to happen in the proximal third of the ureter as that kidney develops, flips, and you get a kink, and you can result in just a diffuse lack of development and hydronephrosis, with the kidney sort of being a big bag of urine. Sometimes it is more focal in nature, from this picture from Matty Kupel. Another common finding, which is seen in up to 1 in 1,500 people, is fusion, usually of the poles of the kidney. And but sometimes you can see them in the middle of the kidney. Usually it causes absolutely no problem. The condition is known as a horseshoe kidney. We can intuit that there has been a significant problem here because of the fact that in this bovine kidney you have marked dilation of calyces, so there has been obstruction. In the vast majority of cases, the ureters, because they don't live at the poles of the kidney, are not involved, and the animal goes on to live a normal life. Mel Gibson is someone who has a horseshoe kidney. It doesn't seem to have slowed him down too awful much. Okay, renal hypoplasia. First thing I want to say is that here's one small kidney and one normal kidney. The first thing to get across is that most kidneys that are diagnosed grossly are probably not hypoplastic at all. It's a fairly uncommon defect, and they're usually dysplastic. And then, in turn, most dysplastic kidneys are grossly normal. So we could run into a lot of problems here. Hypoplasia of the kidney is not an abnormality of the nephron, as we'll see with dysplasia, where there are multiple abnormalities, but it is a reduced number of histologically normal nephrons, lobules, and calyces in the affected kidney. It is usually smaller than the other by fact that there are fewer nephrons, but also by fact that the other kidney may compensate by increasing the size, not the number, but the size of its own nephron. It's a very rare condition. It's been associated with BVD affecting calves in utero. There are 1 or 2 breeds in which it is seen with a little higher prevalence, and it is seen along with an increased amount of renal dysplasia in Japanese black cattle due to a defect in pericillin 1, and often manifests later in life by an increased amount of chronic interstitial nephritis seen in this breed. So we've talked about hypoplasia, and I said grossly, most of them are really dysplastic kidneys. Here is a wonderful picture of several dysplastic kidneys, or at least 2 dysplastic kidneys from a dog. And the first concept about renal dysplasia that I would like to get across, largely based on my experience, is that I was taught that there were many forms of renal dysplasia. And then as time went by, I started to hear different names for this. And I think that there are a lot of names for variants of the same syndrome. You have progressive juvenile nephropathy, which is sort of an all-encompassing term for a combination of developmental, degenerative, and non-inflammatory changes in a kidney, which begin in a young animal and progress over time as that animal grows. These animals usually are distinguished by the fact that in early middle age, or sometimes even younger, they will die of renal failure with advanced changes in their kidneys, resembling those of the end-stage kidneys we talked about in the last lecture. And obviously we have multiple changes in this particular kidney. It is shrunken. It is lumpy bumpy. It with a undulant surface to the cortex. You probably had trouble peeling off the capsule because of the fibrosis. There is distension of the renal crest. It's wider than normal. There are radiating bands of fibrosis. So if you were to say this was a case of nephrosclerosis or end-stage kidney, I certainly would not argue with that with you. But progressive juvenile nephropathy includes all the cases of renal dysplasia, which we're going to talk about in just a minute, as well as a number of other problems in various species, like Samoyeds and English cockers, who do not have developmental abnormalities, but they have abnormalities in the formation of type 4 collagen in the basement membrane. So progressive juvenile nephropathy is an overarching term you'll hear, with the only basic link is that the animals develop chronic renal failure, nephrosclerosis at an early age. You might hear the term familial or breed nephropathy. It's a slightly more restrictive term, often associated with various forms of renal dysplasia, which are well known in a certain breed. I would probably throw the Lhasa Apso out there as the one I think of the most, but there are quite a few of these which develop breed degenerative renal disease, which causes a markedly shortened lifespan. The term hereditary nephropathy is attributed to those few cases where a genetic abnormality has been identified. The disease seen in Samoyeds, for example, would be a good example of a hereditary nephropathy, as that gene has been identified. So let's move on to a picture. I've used this for years. It's essentially a picture of an end-stage kidney, and that's pretty much all you can say from a gross point of view. Now, if I told you this was from a Lhasa Apso in which multiple littermates had similar changes, you would start to think about various forms of juvenile progressive nephropathy, or even renal dysplasia. Renal dysplasia is something that is really a microscopic term. I don't think that you can apply it properly on the gross, even if you know that this is a Lhasa Apso. In the Lhasa Apso, they're generally characterized by renal failure in very young dogs, 4 to 18 months of age. And there are a couple of competing factors or competing opinions as to how renal dysplasia ultimately comes about. During development in normal embryogenesis, the definitive kidney begins as an evagination from the mesonephric duct, also known as the ureteric bud, which grows into a mass of mesenchymal cells known as the metanephric blastema. And the coming together of the ureteric bud and the metanephric blastema eventually becomes the kidneys, and you can imagine the complex interplay that has to happen for the proper development of the mature kidney. And anything that can interfere either focally or diffusely can result in a dysplastic kidney. Another camp believes that it is primarily an outgrowth of obstruction, especially in the collecting duct system, which develops from that ureteric bud. And that is the primary driver of renal dysplasia. As I said before, I don't think that you can properly identify dysplastic kidney, and it is something that is better done in terms of histologic features. And there are a number of features which are common to dysplastic kidneys. Something else that has tripped me up over the years, I learned that there were 4 or 5 characteristic features of dysplastic kidneys, and that you had to have all of them. But over the years, I've seen a number of these kidneys, and you rarely get all 4 or 5, or maybe you don't get them on your 1 or 2 magic sections. But I think a lot of cases may have 1 or 2, but not the full 5. And for those of you who have reviewed your renal pathology, you know that in dysplastic kidneys, the things that you're going to look for are fetal glomeruli, the very small, poorly developed glomeruli that you will see throughout the kidney in dysplastic kidneys, and in very young animals you'll see close to the capsule, and they will eventually mature. You'll also see areas of undifferentiated primitive mesenchyme. You'll see metanephric duct remnants, which are very large, highly basophilic tubular epithelium. You may see blind collecting ducts, atypical tubular epithelium in many areas of the kidney, and finally areas of dysontogenic metaplasia or development of cartilage or bone within these kidneys. If you see 1, you should have a high index of suspicion. If you see 2, you're probably dealing with one of these forms of either renal dysplasia or progressive juvenile nephropathy. At that point, based on the history, I usually go to the literature, because you'll find that so many of these have been characterized in so many different species. I like Lhasa Apsos and Springer Spaniels and English Cocker Spaniels, but there are so many different ones. And a lot of them have a common thread where they have some portions or some portions of the nephron dysplastic, but not all of it. And as I said before, you can also see some areas of the kidney. It can be one kidney, it can be both kidneys, or it can be restricted to one area of the kidney. And here's another case of renal dysplasia in this region of this kidney, and in the other kidney, one's a little shrunken. There's really deep cortical scarring, just very little scarring here, tremendous amount of fibrosis. Remember, whenever you have a lot of fibrosis, you're going to get cysts. So we see cysts here, and large cystic areas both in the cortex and the medulla. Not enough cysts that I would want to talk about polycystic kidney disease, and especially with the lumpy, bumpy, undulating cortex and all the other changes. Polycystic kidney disease probably would not enter my differential diagnosis. And once again, you can have focal areas of renal dysplasia. We're looking at renal dysplasia in a pig kidney. And we talked about how they often will have large cysts or even be hydronephrotic as a result of the kinking of the ureter. I hope that you're at least getting the idea that a lot of these developmental defects appear to be connected in some way to damage to the ureteric bud or kinking of the outflow. Outflow seems to be a common denominator in a lot of these. Somebody has mentioned that this may be, at least in pigs, also a result of hypovitaminosis A, because it appears that there is an interplay between vitamin A and proto-oncogene signaling, which results in the proper insertion of the ureteral buds into the bladder itself, and some obstruction there may be causative for some of these focal dysplastic areas in the pig kidney. Now let's talk for just a minute about cysts. Cysts are generally congenital in origin. They grow over time, but the cyst probably is there from the beginning And we'll look at some exceptions to that rule. But these large cysts probably have been there since the animal was born, and they progressively enlarge over time. One of the things that I will say is the renal capsule is real stuff, and tough stuff, and I will show you some big cysts, and you're surprised that they don't rupture. When we look at true renal cysts, and a true renal cyst is really not going to cause the animal a lot of problem, because as long as the animal maintains 50 to 66% of functional kidney, meaning that the other kidney is normal and most of this kidney is normal, you probably won't see any significant impairment. There are renal cysts, I should say, are probably most common in pig kidneys. We talked about that. And calf kidneys, they usually get thrown away in the slaughterhouse, just tossed into the gut bucket, and nobody sees them again. People do like to eat calf kidneys, so they're not very appealing, and people just don't like to see these defects. Renal cysts in their development usually are the result of one of four potential mechanisms which often overlap. One is, as you would imagine, nephron obstruction. And that's one, and probably the main reason why these things grow over time, is that you get fibrosis. And as we've said before, in the face of outflow obstruction, the one big failing of the kidney is that it does not shut down urine flow. So the kidney will continue to produce urine in the face of obstruction, and then you will get widespread changes, maybe focal cysts, maybe even hydronephrosis. So obstruction is a big part of this. And then the rest have to do with some modification of the tubular epithelium or the surrounding extracellular matrix, between which there is always a constant and complex interchange of signals. You can have de-differentiation of tubular epithelium. You can have deranged function of tubular cells arising from abnormalities in hemidesmosome function, or the one cilia that tubular epithelium results. A lot of the causes of polycystic kidney disease, which we'll talk about in a minute, have to do with compounds on that one single cilium that tubular epithelium possesses. And you're saying, I didn't know they had cilia. Yes, every cell in the body, including round cells and mesenchymal cells, have at least one cilia, and is thought to be necessary for the complex interaction with the cell's environment. So that was a new one on me a couple of years ago. And then modifications in the extracellular matrix can lead to weakened basement membranes, outpouching of tubules, and abnormal urine flow. So it's usually one or more of those particular functions, with I think the abnormalities in tubular epithelium being the most important. There are some chemicals that will also result in cortical cyst formation, including steroids, some toxins such as PCBs, and a drug which we had a great case in Wednesday Slide Conference just last year, called Aloxan, which sort of masquerades in the body as glucose and is absorbed into pancreatic beta cells and renal tubular epithelium, causing significant damage, and that's a form of acquired cyst formation. Not these huge cysts, but in the animals that have been treated with Aloxan, when you cut them, you get this feeling of sort of a Swiss cheese-like gross appearance. One of the species that I've looked at, I think it's prototypical in terms of the basic problem associated with renal cysts and their minimal issues, are ferrets. Ferrets tend to get a lot of renal cysts. About 33% of them have renal cysts, and I generally have not seen them cause any significant impairment. These are usually incidental findings in the cortex at necropsy. Here was one that the decision was made. It was identified on ultrasound, and you look at the large portion, at least half of that kidney is gone, but the animal still had another kidney, which is perfectly fine. And so the decision was made based on the size of this cyst to take it out. And we got a really great picture. I take this one underwater, but it came out very nicely. It shows you just how tough that renal capsule is. Look at this nice covering of fat. That animal wasn't missing any meals or sweating the presence of this renal cyst at all. So the vast majority of time, they don't cause any problem. But then we get into the conditions that are often associated with genetic abnormalities, which are combined. We see them in multiple species, and they are lumped under the term polycystic kidney disease. Polycystic kidney disease comes in two basic flavors. It comes in the the autosomal dominant polycystic kidney disease, ADPKD, and the autosomal recessive polycystic kidney disease. The dominant forms are the ones that the animal generally lives a partial lifespan. It gets out of its infancy or childhood, but over time the disease manifests itself. The nephrons are lost. They are replaced by fibrous connective tissue. This is a cat kidney from a Persian cat, and Persian cats are certainly overrepresented in polycystic kidney disease and get both dominant and recessive forms. But although the kidney normally should be gold, we are looking at multiple cysts because a lot of this white, you can see the cysts which come to the surface, but you can also see the surface itself is sort of undulant, and a lot of this pallor that we see is probably fibrosis of the kidney resulting from nephron loss. The causes of autosomal dominant polycystic kidney disease have been identified in Persian cats. They've been genetically identified in bull terriers. They've been identified in a number of cattle breeds, and they correspond pretty nicely to the genetic abnormalities in humans. This disease is caused by defects in genes known as polycystic kidney disease 1 and 2. That makes them easy to identify or remember, and polycystin 1 and 2. These are all components. They do a couple of things in the cell. They're all components of that single cilium of the renal tubular epithelium, which also becomes a centriole during mitosis. And the polycystic kidney disease 1 is a component of desmosomes. Remember, desmosomes are required to keep the tubular epithelium bolted tightly together and to prevent them from expressing themselves and starting to proliferate. But if you take those desmosomes out or make them defective, they do have the ability to cause papillary projections into lumen, form outpouchings, and that will start off a degenerative process within the tubules. The animals, the Persian cats that are affected with this particular form, with the PKD1 abnormality, often have cysts in other tissues. And when you're dealing with polycystic kidney disease, there are a number of syndromes in which you can see cysts also in the biliary tract, which may be a form of ductal plate malformation, and pancreatic cysts. So they often go together. PKD2 is a plasma membrane calcium channel, but essentially that defect seems to have the same ultimate change in a dedifferentiation or a release from control of the tubular epithelium. So we're lucky that these animals, there are probably a lot more that are born with one mutated allele, but you have to have both alleles mutated in the cases of true polycystic disease. So the first one is a germline mutation, the second one is a somatic mutation. So that's essentially the story, whether we're dealing with polycystin 1 or 2 or PKD 1 or 2. It's a more gradual onset of fibrosis, and the animal, a lot of these lines are well known for having problems with their kidneys. Now, the adult autosomal recessive forms, I think, are very easy to identify, for the simple reason that these animals generally die shortly after birth, or they may even be stillborn. This disease is fully fledged at the time of birth, so the kidneys are both going to be big. And when you look at them on cut section, they are just full of holes. Nothing is working properly. So these are those autosomal recessive people, pigs, cats, dogs. They just don't get out of infancy. Here's a polycystic kidney from a foal. This is an uncommon thing in horses. This was a great picture from a Wednesday slide conference that was submitted. We had a couple of them, but it just doesn't seem very common species. Here's the ureter. We can tell this is the right kidney because it has that sort of Valentine's Day, Valentine's heart look. And we have multiple kidneys going through this. If you were going to cut it on cut section, you would see something that looks very much like this. Sort of a Swiss cheese appearance. I know that in Switzerland they will be throwing their hands up because we call it Swiss cheese in the U.S. It is nothing like the wonderful cheeses that you get in Switzerland. We've really done a job on the worldwide reputation of Swiss cheese, so I will apologize. But there are numerous cysts. The renal cortex is almost all cysts at this point. Some of these probably glomeruli that have undergone glomerulocystic change with these very dilated Bowman spaces, because there's really everything is blind pouches in there, and there's nowhere for that urine to go. It's been producing urine during gestation, and it just has gone absolutely nowhere. So polycystic kidney disease, here's one in a sheep that looks very good. And I really like this appearance and this cut because I've seen a number that look like this. You have to be very careful handling them because they're quite flimsy. So they're not all very well delineated cysts like we see in the autosomal dominant or even some forms. Sometimes they just have this almost lava stone-like appearance with these very fine walled cysts and a lot of fluid within the kidney. Well, that brings us to the end of this particular lecture. I think in the next lecture we're going to start with some of the infectious agents that affect the kidney, and as we always do, we will start with viral disease. Off the top of my head, I don't generally associate the kidney with a lot of viral diseases, but when you realize that the kidney has the largest vascular bed of any organ in the body, then you start to realize that a lot of viruses we associate with vasculitis, like the orbiviruses, the pestivirus, especially of classical swine fever, will affect the kidney very significantly. So that we'll leave for the next lecture. And with this, I will bring this one to a close. And, I hope that everyone out there is being safe, be healthy, don't take any risks that you don't have to right now. We're going to get through this pandemic together. Talk to you soon. Bye-bye.